Good afternoon, everyone. Welcome to today's webinar. We will begin shortly. All right, let's go ahead and begin. Hello, everyone. Welcome to today's webinar, which is part of the Private Water Network's A Year Since Launch event series. Thank you for joining us. My name is Reem Tariq. I am the project coordinator at the National Environmental Health Association, and I'm also serving as the lead administrator for the Private Water Network. Before we get into the details of the webinar, I would like to address a few things about the network. If you are not a member and are curious to learn about what the Private Water Network does and what it has to offer, let me inform you that the network is a virtual community of public health professionals and safety workers that work with private drinking water systems. The network was launched by the National Environmental Health Association in partnership with the CDC and the National Networks of Public Health Institute. The mission of the Private Water Network is to build a sustainable community for those working to support private water programs, to connect with their peers, to share experiences, insights, and resources, and to gain access to timely and relevant guidance for existing and emerging issues, as well as to build capacity to do the work more effectively and efficiently in order to protect the public's health from contaminants in private water sources. Membership to the Private Water Network offers access to a virtual community platform that offers features such as a discussion forum, a resource library, an events calendar, and a member directory. Also, this is a free resource to anyone who would like to join and anyone who works with private drinking water sources. And with that, let's go into our new webinar series. So the Private Water Network will be doing a monthly webinar on the treatment concerns and options on existing and emerging private water contaminants. We're kicking off the series with our webinar today, and we're calling the series the Private Water Network Water Treatment Webinar Series. The title of today's webinar is Private Well Water Treatment for Arsenic. Arsenic is one of the most common contaminants exceeding standards in private wells in the US and abroad. This webinar will explain the major water quality factors to be considered for arsenic water treatment and provide a formula for successfully treating the water. Our speaker today is none other than Steve Spayd. Steve Spayd is a research scientist and a hydrogeologist with the New Jersey Department of Environmental Protection, where he has worked for over 3 decades. His current research is on the geologic sources and effective water treatment for arsenic, radionuclides, and other naturally occurring contaminants. He conducts outreach to private well owners, assists the public with water quality and hydrogeologic issues, and has worked on many groundwater contamination sites. Steve has a Bachelor of Science in Geology and a Master of Public Health and a PhD in Public Health. He's also an adjunct professor at the College of New Jersey and the owner of Diagnosis Water, which is a startup water consulting business for water quality problems outside of New Jersey. All right. With that, let's get into some housekeeping rules before we begin the webinar. Please note that the session is being recorded. Once we wrap up the webinar, I will upload the recording of the webinar onto the Private Water Network community. We will also share any links to the resources if there are any that are mentioned in this webinar and include those in the follow-up email that I will be sending to all registrants. At the conclusion of the session, you will be directed to a short evaluation, which is our annual Private Water Network evaluation. Your feedback will be quite helpful to us in planning for future events, so please do take those 2 minutes out of your day to complete that survey. And with that, let's begin our webinar. Steve, the floor is yours. So let me stop sharing my screen and have Steve share his.
Can you see my screen?
Yep.
Okay, thanks, Serene. Thanks for the introduction. Thanks for having me. Glad to be here. I need to start with presenter disclosures. First, the views expressed in the presentation are those of the presenter, not necessarily the views or policy of the New Jersey Department of Environmental Protection. Mention of trade names or commercial products does not constitute endorsement or recommendation for use. And I do have a financial interest in my new consulting business, Diagnosis Water, which works outside New Jersey, but Diagnosis Water did not participate in any of the work that I'm going to present today. So most everyone knows that arsenic in well water is colorless, odorless, and tasteless. That's why it was such a great poison in the days when they used it to poison people. But the point here is the only way to know what's in your water is to test the water. In New Jersey, we have Private Well Testing Act law that requires people with private wells to test when they do a real estate transaction at a home with a private well. And the data I'm showing today is just through 2014, where we had 86,000 plus wells sampled. And the two most common contaminants are gross alpha at 10%. So 10% of the private wells tested in New Jersey for gross alpha failed for gross alpha, and 8.9% failed for arsenic. So those are our two big ones. And we were really shocked to see that it's the naturally occurring contaminants that are causing the biggest problem with our private wells. The other items are all down below 3%. I want to just show you quickly a map of the US. This is from 1999. Arsenic in the US, and the red and orange are the bad ones. And you could see, pretty much everyone's seen this map. But what I want to point out is areas where there was very little data. So where I have the red circles, there's very little data. And the more testing we do, the more arsenic we find. These are all now known areas that also have arsenic. So here's the 2017 map from USGS. And you can see those areas are now filled in. The darker the brown, the greater the population exposed to arsenic greater than 10. So you can see Maine, Minnesota, northwest Wisconsin, West Texas, Houston area, North Carolina. Those areas had little data. Now they have problems. So as was discussed in the roundtable yesterday, we need more testing, and hopefully we can get that. But I'm here to talk about treatment today. And what do we need in an arsenic water treatment system? Well, it needs to be user-friendly. That means easy to understand and require little effort for the well owner. If it requires too much effort, the effort's probably not going to happen. It needs to be low maintenance, no fuss, check it once a year. Efficient, get all the contaminant out with minimum of waste, expense, or effort. And it needs to be safe for health and for the environment. So we don't want to return that contaminant. We don't want to take the contaminant out of the water and put it somewhere where it's going to cause a problem. Water treatment that I'm going to start with water treatment that does not work for arsenic. Water softeners do not take out arsenic. Granular activated carbon doesn't work. Brita type filters are just granular activated carbon, so they're not going to work. And also magnets don't work. So I'll tell you a little story about magnets. I had the owner of PowerMax Magnets approach me saying that his magnets would remove arsenic from water. Very simple. You just attach the magnets to the pipe and they'll take out the arsenic. So I said, well, we could try it. I have wells that, people would love to see your unit take out the arsenic. So we tried it, and these are the PowerMax magnets. Hooked them up here, And the arsenic is coming in at 35 micrograms per liter. And unfortunately, the treated water was also 35 micrograms per liter. The owner said, well, we didn't wait long enough. That was about after 2 weeks. So I said, well, how long do we have to wait before the units start taking out the arsenic? He said, well, let's try 2 months. So we tried 2 months and we got the same results. So just the idea that some of these ideas outside the box may or may not work. The major factors in arsenic water treatment are listed here. Arsenic species is number one. So arsenic can come in well water in either arsenic 3 or arsenic 5. The problem is that arsenic 3 is an uncharged molecule and difficult to treat. Arsenic 5 is an anion and easy to treat. So what species we have is very important. pH is also a critical factor. Arsenic treatment is very sensitive to pH. And then co-contaminants. So other things in the water that can cause a problem: phosphate, sulfate, silica, iron bacteria, and radium. And we'll get into each one of these things as we go through. The formula for success is convert to arsenic 5 if needed. So if you have arsenic 3, convert it to arsenic 5. We'll see the best ways to do that. Adjust the pH if needed and deal with the co-contaminants. So determining the arsenic species. First off, some commercial labs are now doing it, but there's limited availability and there's issues with keeping the arsenic species stable till it gets to the lab. So for example, some labs will send out a bottle with instructions that the bottle has to be filled with no air. So it'd be like a volatile organic sample bottle. And a homeowner, if they sample it themselves, are not going to be good at filling the bottle without any air bubbles. If there's air bubbles, the air in the bottle can convert the arsenic 3 to 5 on its way to the lab. Also, sunlight, ultraviolet light can convert arsenic 3 to arsenic 5. So the lab may or may not be the way to do it. In New Jersey, based on all our data, we've developed a rule of thumb. So if you have one of these things, you probably have a high percentage of arsenic 3. If the dissolved iron is greater than 100 micrograms per liter, so that would be 0.1 ppm, or if the manganese is greater than 50 micrograms per liter. So one of those, you probably have arsenic 3. If you add the water having a sulfur odor, that increases your odds even higher. So if you have one of these, you probably have arsenic 3. If you have 2 of them, it's almost positive you have it. And if you have all 3, you definitely have the arsenic 3. So that means you have the problem water. Another way to determine species is to use one of these arsenic speciation cartridges, which you can use right in the field to separate out the arsenic. So in this picture here, inside the red oval, is the arsenic speciation cartridge. And it's just a little tiny cartridge that includes water treatment media that only takes out arsenic 5. So what you're going to do is you're going to just take 2 water samples for analysis of total arsenic. So the first sample would be just the raw water. You collect a sample of the raw water, and that's your total arsenic, and send it for the lab for total arsenic. The second sample, you're going to draw up into the syringe and push the water through the speciation cartridge into a second bottle. And because that cartridge takes out all the arsenic 5, the only thing in that bottle will be arsenic 3. And then you test that bottle for total arsenic, and you'll actually get the arsenic 3 value. And then with total arsenic in the raw water, minus the arsenic 3 in the second sample that went through the cartridge will give you the arsenic 5, and you'll know exactly what you have. That may be the most efficient way to confirm what you have, if you're using the rule of thumb. So if you have arsenic 3, how are you going to convert 3 to 5? The chlorine injection is very effective. And another pro is it also kills bacteria. And oftentimes, if you have arsenic-3, it's reduced water, and often that comes with iron and iron bacteria. So the chlorine is good for that. However, there's some cons. If you set up a chlorine injection system, the well owner is going to need to maintain it. They're going to need to mix water and chlorine into the chlorine storage tank. If they forget, then it's not going to work. These pumps, in my experience, often lose their prime, and the homeowner doesn't know that the pump is clicking away, but no chlorine is going into the system. The chlorine may create disinfection byproducts. And if you inject chlorine, you're going to need a carbon tank to remove the chlorine and any disinfection byproducts. So you're adding a lot of equipment to your treatment system. And I'll show you what that looks like in a few slides. Another way to do it is to inject hydrogen peroxide or ozone. These are both strong oxidizers that also kill bacteria. I don't know how good they work because I have very limited use of these methods in New Jersey, but the water treatment people tell me that it works very well. One concern I have with ozone is, how do we know there's not too much ozone in the water? So that's, future learning that we have to do. Just strict aeration of the water is another way to do it. And we find this to be partially effective, which means it converts most of the arsenic-3 to arsenic-5, but the air by itself, it's a much slower process. The air injection systems are usually noisy. And like I said, the slow conversion. The air can be contaminated. So if you're injecting air into the water, you got to make sure it's clean air. So you wouldn't want to be like drying out your paintbrushes next to the arsenic treatment system in the basement, because when it sucks in air, it's going to suck in, paint vapors, and now your water is going to smell and taste like paint. The last method that I'm sharing is one that I like. It's aeration with a catalyst, manganese oxide or manganese dioxide catalyst. These are often called an iron breaker and are often used to remove dissolved iron from water. These are effective at converting arsenic-3 to 5 and are low maintenance. Nothing to mix. It's just a tank that sits there. It sucks in air once every 3 days and does a backwash cycle. The homeowner doesn't have to do anything. Potential problems: the air may be contaminated, does not kill bacteria. And this type of media would accumulate radium. And if the water has radium in it, it should not be used. You don't want to use manganese oxide medias or green sand, which is a manganese oxide coated media. The benefit of all these oxidation methods is that if dissolved iron is present, that iron will be oxidized into ferric iron particles. And the iron particles will absorb arsenic immediately, boom. And those particles are going to be captured and filtered out and then flushed out during the backwash. And this can greatly reduce the arsenic. We see very commonly, if the iron is around 1 ppm, you can reduce the arsenic level in half right in this step, in the pretreatment step, and that's going to extend the life of the adsorption media and save money. But the effectiveness will depend on the iron level. Any iron will help. The water treatment professionals can tell you an optimum iron level. In the example I'm going to show you that works really well is around 1.2 ppm iron. So I'm going to show you an example of a really bad well. It's got arsenic-3, iron, manganese, sulfur odor, and iron bacteria. This was an interesting case. Their whole house treatment system was breaking through after about 3 months. And after studying it and experimenting with it, we found that it was iron bacteria. They were using an iron-based adsorption media. The water had iron bacteria in it, and the iron bacteria thought they were in heaven when they got into the tank, and they were sliming up the media so that the arsenic couldn't get through the slime into the into the adsorption media itself. So let me show you what went on here. So here's the raw water quality. I'm going to show arsenic 3 over total arsenic. So in this case, they have 80 micrograms per liter total arsenic, and it's 100% arsenic 3. Their iron is at 1.2 milligrams per liter, and the manganese is like 200 and some micrograms per liter. So here's the schematic of their very extensive whole house water treatment system. And the orange boxes are the sample ports. So I'm going to show you the water quality at each port. So we'll start down here. The water coming in from the well is 80 micrograms per liter, and it's 100% arsenic 3. So the water goes from the pressure tank through a flow meter, and the flow meter activates the chlorine pump, which sucks chlorine out of the chlorine tank that the homeowner has to mix. So there'd be, depending on the situation, the homeowner has to mix so many gallons of water to so many gallons of chlorine. And that's going to suck chlorine and inject it into the line. Then because of the chlorine injection, they need a chlorine water contact tank because it takes some time for the chlorine to react and convert the arsenic 3 to 5 and to oxidize the iron and the manganese and all that. Then you need some backwashing media to catch those iron and manganese particles that are being created by the oxidation. What we find after the backwashing media, so the chlorine injection, the backwashing media, that the arsenic 3 is now non-detect, less than 0.5 micrograms per liter, and the total arsenic at this point now is just 40. So we've captured 40% of the arsenic in this pre-treatment step, which is very nice. Then these arsenic adsorption tanks last a lot longer. So after the water goes through the first arsenic tank, the concentration before the second arsenic tank is now arsenic 3 still non-detect, total arsenic 3.5. So this was, I think this was about 3 or 4 years after this system was in place. And the first arsenic tank was letting some arsenic through. And the reason we have a second tank is to catch this 3.5 arsenic. So, you know, when you first put it in, it's going to be non-detect. But after a year or two, you're going to have 1 part per billion, then 2 parts per billion, and 3 parts per billion. It's going to slowly build up. And for most cases, people have been drinking this water for, you know, a lifetime, maybe 20 or 30 years before they tested. And so they've already had a big arsenic exposure. So why continue an arsenic exposure? The second arsenic tank, which I call the safety tank, is going to remove that small amount of arsenic and they'll have no exposure. If you have just one tank, they're going to be getting exposed to 3.5, 4, 5, 6, 7, 8 until they change out this tank. The water then has to flow through the carbon tank and to remove the chlorine. And then these people also needed a water softener, and the water going into the house now is non-detect for both total arsenic and arsenic 3. And what does this look like in real life? It looks like this. So sometimes you need a significant treatment system. And you can see all the parts, all the components are labeled here. Here's the chlorine injection storage tank, the chlorine injection pump. This is their pressure tank. There's a sediment pre-filter up here, the water softener, the chlorine mixing tank, the backwashing sediment filter, whoops, and the arsenic worker tank and safety tank, and then the carbon at the end. So that was talking about oxidizing the arsenic 3 to 5. Now let's talk about the pH. So for adsorption systems, arsenic 5 is best adsorbed at pHs between 6 and 7. It has good adsorption up to pH of 8, but above 8, very poor adsorption. So if you're trying to use arsenic adsorption media above a pH of 8, it's going to have a very short life and it's going to be too expensive. So it's worth it to adjust that pH. The way I like to see the pH adjusted is to put in an anion exchange unit. Anion exchange will lower the pH about 2 points. So if you're in the 8 to 10 range, that's going to drop you down to the 6 to 8 range, which will work well. The anion exchange will also remove the arsenic 5 because arsenic 5 is an anion. So, however, there's problems. There's a lot of potential problems with anion exchange, which I'll talk about in a little bit. So I like to see, if you do reduce the pH with anion exchange, I still like to see to have an adsorption tank after that, or point of use reverse osmosis as your backup. So let's look at the arsenic 5 treatment technology. So now we've adjusted the pH, we've adjusted the arsenic species, so we've got arsenic 5. So reverse osmosis will work for point of use applications. We really don't recommend whole house point of use. Anion exchange will work because it removes arsenic 5. The media prefers sulfate though over arsenate, and sometimes sulfate is a problem. And the sulfate can cause dumping of arsenic if the salt level is not maintained properly, or if the system is not set up to deal with the sulfate. So it needs to be set up to regenerate before the sulfate breaks through. And then when an anion exchange system does a regeneration cycle, it's going to backwash out the arsenic. So where's that arsenic going? The best case is to dispose it into a septic system. In New Jersey, our opinion is the arsenic came up out of the groundwater. It should go back into the groundwater. We had one case where the setup was that the backwash water, the regen water from the anion exchange was going out of pipe out to the road, and it was making a puddle in front of the house. So a high arsenic puddle in the road for the kids to play in, which was not good. And we had them redirect that to the septic system. Adsorption media is also good for arsenic 5. You must note that it has a much lower capacity, a shorter life, and a higher cost if you're going to try to take out arsenic 3 without pre-treatment to convert it to arsenic 5. The 3 main types of adsorption media that work the best are iron-based, titanium-based, and then iron-impregnated resin. For point of use, this is what a reverse osmosis system looks like. And I'm always reminding people that it only takes out arsenic 5. And people think, well, if I put in reverse osmosis, my kitchen tap is going to be clean water. No, you're going to get a separate tap that's going to be your clean water for the reverse osmosis. So you'll have your regular kitchen tap and then a separate faucet for the arsenic-free water. And reverse osmosis is one way to do it. Another way is you can put arsenic adsorption cartridges under the kitchen sink for point of use treatment. I really don't like point of use treatment because there's pretty significant data that shows continuing exposure when you don't have whole house water treatment. So there's a couple of studies that families relying on point of use or bottled water, if you look at their arsenic levels in their urine, they're not down to the levels that you would expect them to be. So there's a study done in Maine, and not knowing why aren't these arsenic levels in urine going down as far as they should. And I did a study in New Jersey where we compared people with point of use treatment to people with whole house treatment, and the people with whole house treatment had lower arsenic levels in their urine. And what could this be? This could be probably mostly what I call non-compliance. So they have point of use treatment, but they also get water, drink water from other taps in the home, like from the bathroom sink. In my biomonitoring study, we had one family, mom and dad, and 2 kids, and everybody's, they got treatment, and we're watching their arsenic levels in urine come down, and all of a sudden, the daughter's arsenic level in urine spiked back up. Everybody else was still low. So we talked to the family, see what happened, and the daughter confessed that she was getting a drink every night from the bathroom sink, and it showed up in the data. So it's hard to get people to comply. So just a couple slides to show you what these things look like. Anion Exchange looks just like a water softener. And if there's any water treatment people listening, please label your tanks what they are, because when someone else goes in the basement and there's no label, we don't know what they are. So this is Anion Exchange, and you need salt to make it work. It exchanges the chloride for the anions. But as I alluded to, there are problems. The Anion Exchange does not remove any arsenic-3. If the salt level is not maintained, so let's say you run out of salt, it's going to continue working for a while, but eventually the anions are going to fill up all the adsorption sites on the media. And then if there's a high level, let's say of sulfate coming in, let's say sulfate's coming in at 50 milligrams per liter, that sulfate is going to knock off the arsenic from the media, and that arsenate is going to go into the drinking water. And you could get a glass of water with ppm levels of arsenic. Very common for people not to maintain their level down. One of our studies, and now those were for water softeners. So it's not a life or death situation. And if the water softener is not working, you can feel the hard water. But when anion exchange is not working, you can't tell, you can't feel it or taste it. The other thing with anion exchange is if you have a normal pH, let's say of 7, it's going to reduce the pH by 2 units. So now you're going to have pH of 5, or if you're starting with 6, you're going to have 4. So it's going to make the water acidic and corrosive to the pipes, and you could be causing a lead problem in the drinking water. So this is this is my preferred technology, a 2-tank whole house arsenic adsorption system with pre-treatment if needed. And this is what it looks like in real life when if you have arsenic 5, you have a sediment filter, in this case a water meter, your arsenic adsorption tank, a sample tap, and then the arsenic safety tank. This is where you would take the sample because you want to know when you're breaking through this tank. So when you get above 10 parts per billion coming through the first tank, then time to change. The average price is about $2,800. What co-contaminants can cause problems? Well, sulfate and nitrate, because they're anions. Elevated levels can cause dumping of the arsenic when using anion exchange. So the regeneration, what's the solution? The regeneration schedule should be based on the sulfate and nitrate concentrations. Maintain the salt levels. So if you can't do either of those two things, do not use anion exchange. Phosphate and silica are going to compete with arsenic adsorption sites. So if you have a huge problem with high levels of phosphate and silica, do not use adsorption media. Use one of the other methods like anion exchange or reverse osmosis. Iron bacteria can slime the adsorption media and block adsorption sites. So the solution for that is to kill the bacteria by pre-treating with chlorine or other suitable disinfectants. And then lastly, radium is a co-contaminant that can be a problem if any part of the treatment system has green sand or manganese oxide medias. They love radium. So they're going to adsorb radium, and they're going to become radioactive, and they could become, and so the tank is now full of radium, and it's going to be shooting gamma rays into the house, and the treatment media may now be low-level waste. So low-level radioactive waste. If you're using this type of media, you need to test and see if you have radium in the water. If you do, the radium is easily removed with a water softener as pre-treatment. So really quickly with radium, unfortunately in New Jersey, if you remember, one of my first slides was, wheat gross alpha is our #1 contaminant in New Jersey, just a little more than arsenic. And so we have both. We have radium and we have arsenic. And so we have to watch out for the radium. And if we compare this radium map, so red is bad for radium here, with the arsenic map, we'll see that in New England, in Iowa, in Texas, and probably other places that they haven't tested private wells for radioactive elements. There's probably other places where they come together. So you need to watch out for radium. And radium, and why drink radium when it's so easy to remove? All it takes is a water softener. Cation exchange resin, radium's a cation, it takes it out. Please label the tank. And why does it work so well? Little background science, everyone can jump back to high school science when we learn the periodic table. The elements in a column are going to behave similarly. Their chemistry is similar. So when we remove hardness with a water softener, we're taking out the calcium and magnesium from column 2, and that's where radium is. Radium is down here, Ra. So you take out the calcium and magnesium and everything else in this column with a water softener. So that's why it works well. I want to show you a quick video. This is about 1.5 minutes long. It's a little noisy, but it shows what these radioactive tanks look like. Well, they look just like tanks, but if you use a unit, I'm going to show you a micro R. I'm using a micro R meter to measure the gamma rays coming out of these tanks. Keep in mind that background is, in New Jersey, background micro Rs are about 5 to 10 micro R. And you'll see these tanks go way up. Okay, we're in Vernon, and we're at one of the most radioactive wells in the state. So just want to stop it there for a second. You can see that the arsenic is 25 micrograms per liter here, but the water is very radioactive. It's like one of our worst wells in the state. The gross alpha is 1,000. Uranium is very high in 600, and radium at 65. So these tanks are, if there's any manganese oxide media, and you're going to see this first tank has been in service for only 3 months with a manganese oxide media, and you'll see it's in the 90s. And then the second tank is one that was removed, and it started at 700 micro R. So let me continue. The water treatment system tanks have become radioactive, and hence we're getting some very high readings on the tank here. You can see it's reading about right there, about 90 microhour per hour. If we come back here, you can see the meter pegging on that scale. So move it up to the 500 scale, and about 320 microhour per hour. This unit here is the radon water aeration system. I'll turn off the sound. This is a water softener which removes radium. Got some levels in it, around 220. This tank here is an anion exchange resin. Removes the uranium and the arsenic, and it's reading around 150. This is a neutralizer because this anion exchange resin reduces the pH, brings the pH back up. And that one is not very radioactive at all. Any questions? So just to scare you a little bit about the radioactive water. You don't want to have radioactive tanks in your basement, or you don't want to be the treatment person carrying the tank out. Not to be bringing up all these problems, but another problem we found, because we got to let you know, is that the water treatment media oftentimes is getting through the treatment tanks and into the drinking water supply. So in homes that we tested the faucet screens, kitchen sink, bathroom sink, faucet screens, and we look in the toilet tank behind the toilet to see if there's any water treatment media. And it turns out that in 72% of the homes we tested, we found arsenic treatment media, either in the kitchen sink or bathroom sink filters or in the toilet tank. So just to give you a feel for what it looks like. So this is the screen that was in this bathroom faucet, and these particles here are the arsenic treatment media. And that's what was caught by the screen. Some of it goes through. So you can end up drinking treatment media, small little particles that you wouldn't even see in a glass of water or in a cup of coffee, but they may be loaded with arsenic and now you're drinking them. So this is why we recommend that after the treatment system, you have a post-treatment sediment filter, maybe 5 micron post-treatment sediment filter to catch this. And we've been having people put these in, and we're finding them loaded with treatment media. And we found all types of treatment media. We found water softener resin, anion exchange resin, all types of arsenic adsorption media, granular activated carbon. So it's, if it's in there to catch volatile organics, and then pieces of carbon are getting into water, again, you might be ingesting them. So a post-treatment sediment filter should become the norm. What about system performance and the cost? So a little quiz for you guys. So I'm going to give you an example here. 3 types of arsenic adsorption media available. Which media will you put in? So media 1, so 3 types of media. We don't know how well they're going to perform. Media 1 is $700 per cubic foot. Media 2 is $800. Media 3 is $1,000. Most people are going to pick media 1, $700 per cubic foot, but let's see what happens. Let's see the performance and the long-term cost. So here's a graph. And on the x-axis, we have years since the treatment system was installed. And we're taking yearly samples of the water. And on the y-axis, we have the arsenic concentration in micrograms per liter in the treated water. So the raw water is coming in at 30 micrograms per liter. And let's say we're in New Jersey, so we want to meet the 5 microgram per liter arsenic standard that New Jersey and New Hampshire use. So year 1, the all 3 media are running, close to non-detect or 1 part per billion. In year 2, media number 1 is already up to 5 parts per billion. In year 3, it's up to 10. So media 1 is breaking through rather rapidly. Media 2, slower, and media 3, much slower, a much more gradual increase so that we don't reach 5 micrograms per liter until year 6. So what does this mean for long-term costs? Media 1 in 12 years would have to be replaced 6 times because every 2 years you're breaking through at 5 micrograms per liter. So over 6 years, it's going to cost you $4,200. I'm sorry, over 12 years because six change outs. Media 2 is breaking through at 3 years. So it's going to have to be replaced 4 times in 12 years. So that's going to cost you $3,200. And media 3 is not breaking through until 6 years. So you only have to change it out twice. So it turns out that media 3 is your best bet. So if you picked media 3, you should say it in the chat so we know who made the best decision. Now, hopefully, someone who chose media number 1 and they found that their system's breaking through after 2 years would talk to their water treatment professional about, hey, this media is not working that good for my water, my type of water. So are there other treatment media available that might work better? And there probably will be. The other thing is the gentler the slope of this curve, the less exposure that's going to occur between sampling. This graph shows 1 year sampling, which we recommend, but hardly anyone does annual sampling. People will tell you they're doing annual sampling, but when you ask them for the lab sheet, they'll pull up the lab sheet and like, oh, it was 4 years ago. Seems like it was just last year, but it's super common for people to slip 3, 4, 5 years before they take another sample. So, you know, if you're using media number 1 and you wait 5 years, well, you're drinking, you might as well not have a treatment system. You're drinking the full load of arsenic. So what about maintenance and testing? So we got to test because we can't see, taste, or smell the arsenic. We got to monitor. So we recommend once per year, and you also need to test under stress conditions. The faster the water goes through the media, the harder it is for the media to catch the arsenic into its orbit. So if it's time to take your water sample and no one's been running the water, and you just turn on the kitchen sink for a minute and run it at 1 gallon a minute and fill the bottle, those are like the optimum conditions. It's not going to be the same as if there's a teenager taking a shower and the dishwasher's running. Now you have lots of water going through really fast. So those are the conditions you want to do when you're collecting the sample. So you should run the water for sampling at the maximum use rate. Usually I recommend two faucets, kitchen sink and a bathroom sink, you know, kind of, you know, almost full blast. And the system should be, you know, testing and maintenance should be overseen by a water treatment professional. Some resources, we have a arsenic water treatment guidance in New Jersey, which we're trying to revise to include some of this new material I'm showing you today. We also, you know, in cooperation with Columbia University, we made a New Jersey arsenic awareness site that has arsenic frequently asked questions, and it covers, you know, there's frequently asked questions here for everything and a lot on treatment. So this is a great website. And so what are the take-home messages? Arsenic from natural geologic sources is common in well water. Whole house absorption is my preferred treatment. But if necessary, convert arsenic 3 to 5, adjust the pH to less than 8, and deal with the co-contaminants. Arsenic and radioactive elements often co-occur in private wells. So if you're in an area with radium, test for gross alpha or radium, and then remove the radium with a water softener if you have it. And pre and post sediment filter cartridges to prevent arsenic-laden media from getting into your drinking water supply. And, you know, I'm presenting information that I've gathered from dozens of people, New Jersey DEP, New Jersey Department of Health, the USGS, the CDC, EPA, Rutgers University, Columbia University, Stevens Institute of Technology, people in other states, people in the water treatment industry, manufacturers, distributors, installers. I'm just passing it on. So hopefully you guys have picked some of this up, and now it's your turn to pass it on. And hopefully we've got time for questions.
Great, thanks so much, Steve. That was a very, very helpful presentation. Just as a reminder to our attendees, please use the Q&A box to drop your questions for Steve. I see that we already have some questions, so let's go right into it. So Max says, hi, Steve, nice presentation. And he's got a question that goes like this. In the system that uses chlorine, is there any media in both the arsenic worker and arsenic safety tanks?
Yeah, so so when you're using chlorine, the media, you know, the adsorption media in those tanks is fine with the chlorine. The chlorine doesn't hurt the media. In fact, the chlorine is good because if there's a need to convert arsenic 3 to arsenic 5, there's also the potential for iron bacteria that could be sliming up the media. So the chlorine getting in there is good.
Great, thank you. Another question we have is, based on your experience, what would you recommend to a private well owner whose groundwater contains arsenic and is seeking advice for a treatment system?
So I like the best, the whole house arsenic adsorption treatment media. The best capacity, the type with the highest capacity in New Jersey that we've seen is the iron-based media. but the titanium and the iron impregnated resin type medias also work effectively.
Excellent. Thank you. Another question. This is by Mary. She also says, wonderful and very helpful presentation. Um, will a link to this recording be sent to the attendees? Yes, we will be sending out a link to the recording, and we will include the resources that Dr. Spayd mentioned in his presentation. So that should be fine. So I've got a question, Dr. Spayd, is, your presentation sort of reminded me that a private well owner who has arsenic in their well, um, they need to have some basic understanding of chemistry. So my question is, in doing outreach and education for private well owners in New Jersey, how do you communicate the risk to the private well owners? So what approaches have you adopted that have worked, and what has not worked in your experience?
So really in our experience, the homeowner is really, you can't really train a homeowner in these basic chemistry items. They really need to rely on their water treatment professional. And it's enough for us just to get the water treatment professionals up to speed. In New Jersey, water treatment installation for private wells is completely unregulated. You don't need to be certified, tested, there's nothing. Anybody can start a water treatment business today without any experience or education. So, and a lot of states have a similar problem. So we've kind of focused on reaching out to the water treatment professionals to get them up to speed so that they'll know the right thing to do.
Great, wonderful. Um, Harry asks you to reiterate what kind of costs are involved with all the tanks that you mentioned. I think a lot of people found that quite helpful. If you could maybe go over that quickly.
Yeah, so as you can see, it does get expensive. So a basic whole house, well, let's start with point of use. For point of use, for around, but let's say between $400 and $800, you can have a reverse osmosis system installed or a point of use arsenic adsorption system installed under the kitchen sink. So that is the most affordable way to go, especially if you don't need any pre-treatment to convert arsenic 3 to arsenic 5. The whole house arsenic treatment system with 2 adsorption tanks costs about $3,000 in Jersey. And I don't know how the prices compare to other states. Anion Exchange costs about the same as a water softener. Maybe I think the media is a little more expensive. So whatever a water softener costs, maybe $1,200, $1,500. The carbon tanks are not that expensive. I think they're under $1,000. And the chlorine injection, I really don't know, but there's the pump and the chlorine tank. Yeah, it's not going to be cheap, but I don't know the cost.
Great, thank you. I don't see any other questions from our attendees. Just a reminder to all the attendees that if you do have any last minute questions, feel free to drop those in the Q&A box. But Dr. Spayd, I do have a question for you. In dealing with the arsenic issues in New Jersey, what's been your biggest challenge in working towards treatment for arsenic?
So I guess the number one challenge is to get people to test. In New Jersey, even though we've had this great private well testing law since 2002, so let's say 2002 to 2020, it's been 18 years. And through that program, we've sampled about 25% of the private wells in New Jersey. So that's fantastic, that's great, but there's the other 75% need to get tested. In some areas, statewide, we're running about 8% or 8 or 9% for arsenic exceeding the standard. In some areas, for example, our Piedmont region, it's 17%. And in some parts, in some towns and areas, it goes up to 60 or 70% of the wells tested failing. So if you're in one of those neighborhoods, you're just, without testing, you're just drinking arsenic for no good reason. So testing is number one. And then the second one is to, once people test, it's another lift to get them to actually install the treatment. So in our outreach efforts, we're starting to do follow-up to see, okay, we tested your water. We told you it was bad. Now we want to know, did you put in a treatment system? If not, why not? So then we can try to overcome those issues. But we really don't know what all those are besides the obvious of, it's too expensive. We put it on our list. We didn't get to it yet. So that's
That's
about all I have
helpful.
on that.
Got it. You referenced an article that you published. Is this kind of information what you're mentioning in terms of, like reaching out to the private well owners in that area, finding out if they've installed the treatment, if they had contamination issues? Have you published any work on this recently?
Yeah, we have. New Jersey is one of the states working with CDC through SafeWatch, and we've done a lot of outreach, and we've published a bunch of papers recently. I could probably provide links for those outreach papers.
That would be great. Wonderful.
Yeah.
All right. I see that we don't have any other questions from our attendees. I guess we will just wrap up 5 minutes early since we're pretty much out of time anyway. Uh, of course, I want to thank Dr. Spayd for his time and sharing his expertise on arsenic treatment. Also, want to thank all the attendees for participating today. As a reminder, please do not forget to take the Private Water Network annual survey. That'll pop up as soon as you close out of this webinar. Obviously your feedback is critical and it will help us plan for future events and webinars, and also maybe to tweak the program if need be. And with that, thank you again for joining us today, and we will see you next time.